My name is Dr. Mirzaei, and I'm a psychiatrist here at the Royal in the Mood Disorders program. So the consult clinic is a service that we offer here at the Royal, whereby we provide a psychiatric consultation to family physicians for their patients with mild to moderate mental illness. And we started the consult clinic in fall of 2012 in response to growing demand for our psychiatric expertise here at the Royal, as evident by the increasing number of referrals and wait times, with two goals in mind. The first one being to provide timely access to family physicians and their patients for psychiatric consultation. And the second goal was to enhance family physicians' capacity in treating their patients with mild to moderate mental illness. As you know, family physicians are almost always the first line of contact for patients with mental illness, and they have the knowledge and expertise most often to manage these patients. And I know from working closely with a number of different family physicians that often what they need in terms of psychiatric expertise is some guidance around clarifying, what's the underlying diagnosis. Is it unipolar depression, for example, versus bipolar depression? Or sometimes it may be some recommendations around how to optimize the patient's medication, or even sometimes it's a matter of finding out about some of the community resources. And these are some of the things that we offer in the consult clinic. So the way the clinic works is that we need a referral from a family physician in the Champlain region, and we see patients between ages of 18 and 65. And the way it works is that patients who are referred to the clinic are initially seen by the clinic nurse for a brief assessment, and then they see the psychiatrist, who then does a detailed psychiatric assessment and then provides the referring physician with a detailed report that has the patient's diagnosis and also management recommendations around both medication and also recommendations around if there's any types of counseling or psychotherapies that may be appropriate for the patient, and where in the community some of those services can be obtained. For patients who reside outside of Ottawa, we offer consultations through telemedicine. So one of the other services that we offer through the consult clinic is telephone consultation for family physicians. And again, this is another way to enhance family physicians' capacity in terms of managing their patients with mild to moderate mental illness. So for example, if a patient is not on any psychiatric medications, or if they've never had a trial of a first-line treatment, we will offer the family physician a phone consultation by one of our psychiatrists. So once the patients are seen in the consult clinic, the consultation report is then sent to the referring physician within 1 to 2 weeks. And then the patients will follow up with their family physician, who will then implement the recommendations and provide the ongoing care and follow-up. So in terms of who would be a good candidate for referral to the consult clinic, would be a patient who either has never had a psychiatric assessment and the family physician is not clear in terms of what is the underlying psychiatric diagnosis, or it may be that they have a diagnosis or the family physician may have started them on first-line treatment, but they're not sure how to optimize the treatment and where to go in terms of the next steps. So those would be some of cases that would be appropriate for the consult clinic. If a patient, however, doesn't have mild to moderate mental illness and they have more severe mental illness, or they have a very complex psychiatric history that may need ongoing psychiatric care and follow-up, they may be more appropriate for referral to the program, where they can receive more intense services.